If you look at the risk factors in stroke, you can see many of these are similar to other risk factors we've had, and that there are some things that are modifiable and there are some things that a person really cannot change. But really, the number one risk factor for stroke is hypertension. So that is why hypertension really needs to be managed under control. Obviously, if someone already has coronary artery disease, if they had a past heart attack, they already have that atherosclerotic process going on. And as we mentioned, it goes throughout the entire body, so they are also at risk of a stroke. We talked about diabetes as well, that really accelerates the atherosclerotic process. Atrial fibrillation, that type of arrhythmia on the ECG where the atria kind of quiver, it tends to form blood clots. In male gender, especially more with older, obesity, poor diet, smoking affects blood pressure, not surprisingly, sleep apnea, dyslipidemia, once again, atherosclerosis, physical inactivity. And then there are what's called transient ischemic attacks, or TIAs. Those are mini strokes. And so they cause stroke-like symptoms, but they cause little to no damage on the short term, but it really increases someone's risk of stroke tremendously. Also, people who get particular types of migraines are at increased risk of stroke. And we have a former graduate student that had happened to. She had severe migraines, and she had also had a stroke. We also had an undergrad a couple years ago that shared in class that in class she was, in summer session, she was having a severe headache, and they really thought that she was potentially having a stroke, and it also turned out to be a migraine. So if people have migraines, particularly if they get what's called an aura, where they get a haziness in front of their eyes, that really does increase their risk of stroke. So something to keep in mind. The stroke belt. This looks very familiar. Look at, not surprisingly, the southern states, we have the highest incidence of stroke in the country. And if you remember back when we looked at the classes on pulmonary disease, these once again are the tobacco producing states. So tobacco producing states do tend to have more higher deaths from stroke. And so if you look at the number of deaths compared to African Americans and Caucasians, you can see it's double the amount in African Americans versus Caucasians. So, what happens with treating stroke? And we touched a little bit about this previously. In exercise, people are going to have trouble reaching their max. And, so they're not able to work out a very high capacity. But if they do exercise, that's going to reduce their risk of death by about 20%. So, these benefits with exercise. What does exercise improve? People who have a stroke are typically going to be on a lot of medications, beta blockers, other drugs to control their blood pressure. They may be on vasodilators, diuretics, anticoagulant drugs such as aspirin so that blood clots don't form, or other types of drugs. They could be at risk for seizures. They could take anti-seizure drugs, drugs for anxiety and depression, muscle relaxers if they're less with spasticity. And they may have some drugs to help with their cognitive function if they've lost some of that. And Aricept is a drug we'll talk about that is used commonly in Alzheimer's.